Namaste, my name is Dr. Satendra Singh. My pronouns are he and him. I am a professor in a medical school in Delhi, India. I am a disability rights activist and ally to the queer community. So I was born in a small village in a city called Rewari in Haryana in India. And I was the youngest of all. We were 4 siblings. I was the most healthiest. Then after 9 months, I contracted polio. And because of that, I would say there was a blessing in disguise, because my father, who was in army, he took me to the capital of India for better education and treatment. And I became a medical doctor. For a very long time, I continue to use the terms which are little bit problematic if you ask the intersex community. I continue to dehumanize or reduce intersex identities into pathological disorders. There are a lot of implicit and explicit biases within medical institutions. And unfortunately, we as medical doctors are training our future doctors these things without thinking about them. When we are talking about intersex variations, we are talking about sexual characteristics which are outside the typical male and female binary. For a very long time, medical profession in India as well as abroad, they continue to visualize these bodies which are different as things which needs to be fixed. That these are the things which needs to be aesthetically corrected. If there is a newborn, an intersex child, the first thing is that the parents are clueless, because they have absolutely zero understanding about what is the meaning of an intersex child. And because of that, many a times there is a demand from the families also, why not change this child into a complete boy or a complete girl? Because of that, it becomes easier for the surgeons to wield their knife. And unfortunately, most of the time, clinicians make those decisions on these bodies without consulting the people who inhabit these bodies. In 2019, I attended the first ever national conference on rights of intersex people. When I listened to those stories, I realized that there is a lot of parallels between how intersex bodies are visualized in comparison to disabled bodies. There's a threat to bodily autonomy in both disabled lives as well as intersex bodies. And there was an turning point for me, maybe because of my disability, because since a very long time I was grappling with internalized ableism, because my curriculum, my medical textbooks, they taught me that I am part of the pathology, that I have something which needed to be fixed. I grew up in a very protected environment, and the medical school was the time when I was out in the open, living independently. But when I applied to a position in the Ministry of Health, I got a rejection from them. And they said that you have mentioned that you have a disability. I said, yes, I have a disability. And they said, how can people like you teach in a medical college? That moment questioned my competence as a medical doctor, as a physician. And I filed litigation, and after 4 years of my struggle, I unlocked around 1,674 positions for doctors with disabilities in India. And there was a rise of me as an accidental activist. Then I made a few petitions to make all medical schools in India disabled friendly. It was the intervention of Gopi Shankaran, a very prominent intersex activist within India, who filed this case in High Court of Madurai, and based on that, these unnecessary surgeries were banned in that particular state. And together we made this representation to the Delhi Commission for the Protection of Child Rights, that these unnecessary medical surgeries should be withheld till the children is able to make informed decisions, except in life-threatening emergencies. They passed this recommendation that such surgeries should be banned in the capital of Delhi. And then I realized that, basically the root cause of this is mindset. And we need to change the mindset of future health professionals as well as current health professionals. And we need to change, or rather transform, these health systems into places which safeguard dignity, which protects the autonomy of the individual. So based on that, we did an audit of the foundational textbooks in medicine, how they are representing intersex variations. And we came up with an inclusive audit textbook tool for the editors, those who are writing books, for the publishers. The second thing was that we implemented trans-affirmative competencies for both transgender individuals and intersex individuals in the first year of medical students, because I believe that probably they would become more compassionate doctors in future and respect their bodily autonomy and their gender identity and expression. If you ask me how many lives I have changed, I would shy away. I won't answer that question. But what I believe is that even if you are changing one life, that matters, the quality. Because when you are changing one life, then you can expect that that one person would go out in community and change multiple lives, and that will create a ripple movement. And that is what an ally is or ally should be.